Oh, I should start. Sorry. Hello, my name is Jamie, and I'm one of the public health chairs for today's health education topic. And we will be talking about gout and what it is, its prevention, management, and treatment, and resources for it. So what exactly is gout? Gout is a form of arthritis or the swelling and tenderness of your joints that may cause severe pain and redness. Gout can mostly develop in the big toe as well, but it can also be found in joints in your ankles, knees, elbows, wrists, and fingers. You will feel intense joint pain, lingering discomfort, inflammation, and redness where the affected joint becomes tender, warm, and red. And as gout progresses, you may even not be able to move your joints normally. In addition, you may also see some tophi or strange lumps around your joints, as you can see on the right picture, where the person's joint, big toe joint, it has a little bit of redness and inflammation in it. And you may also develop kidney stones. So what exactly causes gout? Gout develops when there is a large amount of uric acid in our bodies. Uric acid is a component or a substance found in our bodies that come from food we eat, which contain purines. When we eat purine-rich foods, which we will talk more about later, the purine gets broken down into uric acid, and the uric acid forms crystals around our joints, as you can see in the picture below, which will cause the inflammation, pain, swelling, and the other symptoms I've mentioned from the previous slide.
Okay, thanks, Jamie, for that introduction. So now I'll be talking about the different stages of gout progression. So the first stage is when you have high uric acid levels. So this is when uric acid starts to build up in the blood and starts to form crystals around the joints. Then the next stage is known as acute gout. And so this is when symptoms start to occur, and these symptoms normally cause a painful gout attack. Then going on to stage 3, this is when a person has already had a gout symptoms or flares, but is currently not having any joint pain or swelling. Lastly, stage 4, this is known as chronic gout, and this is when the patient starts to experience gout pain more frequently and tophi starts to form in the joints. So what exactly increases your chances of getting gout? So there are several different risk factors that I'll be talking about. Some of them include being male, being overweight or obese, and having certain health conditions such as congestive heart failure, high blood pressure, diabetes, or poor kidney function. Lastly, using certain medications such as diuretics or water pills could also increase your chance of getting gout. So there are several ways to manage the pain from gout. Normally, patients use NSAIDs such as ibuprofen or colchicine, which is an anti-inflammatory drug, or even steroids such as prednisone. And these may come in either pill form or it could also be injected into your joints. So doctors could also recommend preventative therapy to lower uric acid levels using certain drugs such as allopurinol and pegloticase.
Thanks, Rachel, for that introduction of how to prevent and treat gout. I'll be going over a few more methods on how to prevent gout. So one way to prevent gout is by maintaining a healthy weight. Being overweight causes your body to produce more uric acid, making it more difficult for your body to eliminate the uric acid. Additionally, maintaining a healthy weight can further minimize the weight you put on your joints and can minimize the pain from your gout. In order to prevent gout, you should also limit your alcohol since it's a risk factor for developing gout. Additionally, you should try to avoid foods rich in purines. As Jamie mentioned earlier, purines lead to the formation of uric acid, which then leads to gout. Some foods rich in gout include red meat, anchovies, shellfish, and sardines. Although you should limit your intake of purines, it's also important to note that studies have shown that vegetables with purines does not increase the risk of developing gout. Lastly, you can also prevent gout by eliminating the use of hyperuricemias such as diuretics. However, please note you should not stop taking any medication unless you are told to do so by a medical professional. If you're concerned about developing gout and want to stop taking any medications, please consult your doctor before you do so. And again, this is just a slide highlighting foods you should avoid eating. One of them includes alcohol, soft drinks, seafood, and foods rich in purines. These can make it more difficult for your body to process the uric acid that your body produces. Additionally, you could decrease your risk of gout through dairy, foods high in potassium, black cherry juice, blueberries, and lemon juice. These will help mitigate the risk of gout. We also wanted to include some resources for gout management. So the first one we have listed is UCSF, specifically UCSF Rheumatology, which is a branch of medicine that focuses on arthritis. So UCSF does have specialized medical professionals or rheumatologists to treat gout. I listed their phone number here. And another resource is the National Kidney Foundation. The kidneys are important for processing the uric acid in your body. So the National Kidney Foundation just has a lot of resources, and they even have a mobile app called Gout Central. For more resources, you could also check out the Gout Education Society. And lastly, please check out Mabuhay Health Center. We have monthly health clinics where you can talk to medical professionals if you have any concerns about gout or your health in general. It's every second Saturday of the month. We listed our email here and our phone number. And then on our next slide, we'll have, this is a link tree. If you want to access any of the resources, go ahead and take your camera app and scan the QR code, and a link should pop up at the top of your phone. Go ahead and click it, and it'll lead to a bunch of links from this presentation and past presentations on some public health resources you could access. And finally, we just want to thank everyone for watching. We wanted to thank SOMCAN for giving us feedback and helping us out with this presentation. Thank you.